So let's look now at a case study. So a clinical evaluation report writer is tasked to create reports about eczema lasers and also about nebulizers for children. What available literature can be used? So the goal is to build the search strategies and demonstrate that you've built them, demonstrate that you keep them up to date, demonstrate that you've received the results and that you can reproduce the results, and you need to find the best available evidence. So you want any mentions of adverse device effects, you want the clinical background, current knowledge, state of the art, and you want to demonstrate that you've compared the device with an existing device, and you need to create alerts, create a way to have a continuous update and evidence that you are keeping this literature up to date. So this is an example, and don't be too worried about what I wanted to show you exactly. This is an example for the adverse effects of eczema lasers. So just to tell you some of the things that we've done. So we've used the M-based thesaurus, and we've used the adverse effects special qualifier. And then in Medline, we've used the Medline thesaurus, and they just have an adverse effects. It's not specifically a device effects, it's an adverse effects. And then we've used the synonym, medical device synonym lookup, the medical synonym lookup in Dialog to make sure that we include all of the possible synonyms for this product. And then we've combined the results of the search, and in this case, just to keep it simple, I put a date range in, everything published since 2018. So it's a comprehensive search, it's making use of the thesaurus, but it's also keeping in mind that some databases do not have thesauri, or it's not appropriate to use their thesauri. And so here we've got the synonyms, and we've also free text put in free text terms for adverse event or complication or untoward or degrading and so on. And the other thing to bear in mind is in a service such as Dialog, the references are deduplicated. So the resulting 82 are 82 unique references. And these are the results we got from this search. So again, very similar. In fact, it's the same search that I showed you at the beginning. So 56% from Medline, from Embase 17%, and the hierarchy that we saw at the beginning. And these are just some of this is just the free format from Dialog, showing you the title, the bibliographic information, and the keywords. And again, you can build into your search acquisition of full text from your favored full text provider, or by just using the DOI. So again, just to show you, do not just rely on one database, and make sure that your search strategy is strong, precise, and balanced for recall. And then this is another search example using a PICO. So something else that the regulations recommend is that you use a PICO search. And this is an approach that's very common in systematic reviews. And in fact, the medical device literature requirements do amount for some of the searches to essentially be a systematic review. And so we wanted to look at children 18 and under using nebulizers. So the patients were the children 18 and under. The intervention was the use of a nebulizer. The control was looking at using a vibrating mesh versus a jet. And the outcome we were looking for was if there was an improved aerosol medication delivery. So this is an example of where we're looking at the clinical background for nebulizers. And then interestingly here, we got more results in health research full text, 30%. And this is probably because it has a lot of nursing information and evidence-based medicine from the field, so to speak. And if you think about it, with a PICO search, It's very much evidence-based. So that's probably why the results are slanted in this way. Embase is still strong at 23%, Medline 14%, current contents at 11%, and again, bearing out the fact that this is evidence, more of an evidence-based search, British Nursing Index is at nearly 9%. And again, another nursing index, MCare, 4.5%. And then we have an engineering database at just under 1%. So again, the usual suspects are coming up here again and again, but with a slightly different emphasis based on the type of search. And this was the search that we actually did. So we actually here used a free text search with lots of different synonyms and terms. And then we used comparison, free text, searching in specific fields. And this is the quick format, the sum of the results, as you can see. Metered dose inhalers versus nebulizers for the delivery index. And then this example was an example of eczema lasers and a comparison search. So here we have all of our synonyms for eczema lasers, and then we've actually used the Embase thesaurus as well, and we've used their special term for device comparison. Medline doesn't have a special device comparison qualifier term, so we've just used the mesh heading for eczema lasers, and then we've combined the results of the searches. And again, we have the evidence base, more database, health research, full text. And the advantage of this database also is that it has a lot of full text journals. Medline actually came out better than Embase here, and British Nursing Index, again, very important for the evidence base. And then these are some of the results. So you can clearly see comparison of eczema laser, a multi-center randomized trial, and then the study aims to compare the impact of non-mechanical eczema-assisted lasers. So you can see immediately which of the results look the best. And as I said at the beginning, if you take if you get one article and you think this is gold standard, this is exactly what I want, then look at the indexing, look at the terms, and go back and refine your strategy. Iterate your strategy according to the keywords and the thesaurus terms used in your gold standard search.